Hello, everyone. My name is Solome Tibabu. I'm the director of the Upswing Fund for Adolescent Mental Health, and I'm so excited for our next Ask the Expert episode here with Dr. Ben Miller from the Wellbeing Trust. Dr. Miller, thanks so much for joining us.
Oh, Solome, it's an honor. Thanks for having me.
Why don't we get started by telling our audience a little bit, what is the Wellbeing Trust?
Yeah, so if you're not familiar with us, we are a national foundation focused on advancing the mental, social, and spiritual health of the nation. That sounds like a mouthful. So let me tell you what we're trying to accomplish, what our goal is. We aim to decrease deaths of despair. These are deaths to drug, alcohol, and suicide by 100,000 lives over the next decade, which is a heavy lift. So that's why we need to have all hands on deck looking at the mental, social, and spiritual health of our nation. We invest in a variety of different strategies, which I'm sure we'll get into talking about later.
And you also have an exciting new role there. Can you talk about what you do at the Wellbeing Trust?
Yeah, it is pretty exciting, right? So the last 4 years, I have been Chief Strategy Officer. Actually, when I started with Wellbeing Trust, I was Chief Policy Officer, and then I became Chief Strategy Officer because I like policy and then I like strategy. And recently, the board and our CEO have agreed to make me President of Wellbeing Trust, which is pretty exciting. What does this mean? Well, it basically means that all that policy and strategy stuff that I've been working on the last couple of 4 years, it means that now I'm responsible for actually delivering on it. So it's a little bit more pressure to make sure that the strategy's right, but totally enthused to be in this situation. We have an amazing team at the foundation and amazing partners like you that's doing great stuff all over the country.
Well, I couldn't think of a better leader for the role. So this is really exciting news for the entire field.
Thank
And
you.
congrats again. Um, if you could actually talk a little bit more about how did you get into this whole world of policy, mental health?
Yeah, so it begins in a garage where I began losing my hearing because I was playing punk rock music too loud. And I just realized like, hey, this is really pretty cool, but I'm probably not going to be able to make a living or have a career playing punk rock music in a garage. So I kind of fell in love with this idea of, getting more education. I went to school. When I went to college, I got my degree in psychology. Like most people, when you graduate, you don't really know what you're going to do next. So I taught special education for a couple of years, and that's truly so amazing. That's where I learned so much about the importance of families and communities and education and mental health. And the principal of the school that I worked at was a psychologist. And it was one day, I remember this very vividly. It was a really rough day where we had had a bunch of kids that had been in a fight. There was a lot of angst amongst the staff about how do we handle that. And he said to me, he was like, listen, you're never going to help these kids unless you change the system. And the only way you're going to change the system is to get out, go get more education, and figure out ways that you can connect dots. And so that's what I did. I went out and got my doctorate in clinical psych. And literally, Zolome, I probably at least once or twice a day, I think about those moments where I was a teacher. Now, I've had a lot more moments since then and exposed to a lot of great families and kids along the way. But truly, it was those moments of those students that I had for 2 years and seeing how they wanted so badly to achieve. They wanted so badly to be successful, but their situation, their context, the policies that almost disenabled or kept their families from being successful were the ones that needed to be changed. So that's now what I get to work on.
Wow, I had no idea. Amazing story. Thank you so much. So now coming into today's activities,
Yeah.
there's a lot of policy activity right now in mental health. And what's most exciting to you?
Well, I think the biggest thing that I believe is exciting is that we as a nation are talking about it in different ways. So, COVID has been pretty horrible for most of us, some communities more horrible than others. But there's one thing that I think we've all been able to relate to, which is how challenging it's been on us emotionally. Whether it's kids running up and down the hallway while you're trying to talk on an interview, or whether it's like not being able to put your kids in school, whatever it might be. It's just there's so much here that we've had to face as a nation. So I actually think that normalizing mental health and seeing that it's been a natural part of all of us the last 12 to 15 months is exciting. Now, what does that mean for policy? It means that policymakers are talking about this a lot more because each of us are talking this more. Just about 2, 3 weeks ago, I had the opportunity to testify to a committee in Congress, the Senate Committee on Finance, and we get to talk about these big issues like, well, what do we do about the workforce? Like, where do we put mental health clinicians? How do we make sure that we're identifying and treating properly? And then how do you pay for it? I can't tell you the last time I saw something that was that robust and comprehensive in a discussion in policy. And actually, for that committee, which is a very powerful committee, it's only the second time in their entire history that they brought on mental health. Second time. So that makes me excited that folks like you and me and others that are probably going to watch this, it is our moment to join hands and to do something radically transformative for mental health.
That's so exciting. Couldn't agree more. And I noticed that you recently announced that 20 or so emerging young adults joined your National Mental Health Advisory Board. What is that all about?
Well, you can't do meaningful policy without having the people at the table who you're actually creating policy for. And so by the time we make some of the changes in policy that I'm talking about, it is not going to be me that is served by those policies. It's the next generation. So part of our thinking here is that we need to have the folks who represent the next generation at the table with us, designing what the policies are, thinking through the strategies. What is it that they actually want? And if they're able to tell us that and articulate that and give us that direction, then we, as the folks who are kind of in more privileged places of power or authority, we can take that and run with it and do it with them. So it's an extremely exciting thing. We brought along this advisory group because we needed them to help guide us. We knew that there was I don't want to say it was a misstep, but a lot of organizations fall victim to this, where they get into this, they listen to the folks around them and they don't necessarily listen to that next generation. And so we had done a study a couple of years ago that found that one of the most robust ways to address adolescent policy was to have the youth at the table from the beginning. So we wanted to actually listen to what our experts were telling us to do. So that's part of the reason where it came from.
That's so great. And I wish many more could learn from that. And I'm confident a lot of great things are going to come out of it. And one last question, if I can, do you have any advice for those who are listening who want to get involved in the policy scene? What's a first step they can take?
Yeah, well, the first step is take a breath because there's so much out there. It's almost overwhelming. I mean, Salome, the number of times that I sit in a room and people say, I don't understand it, or it's too complex, or that's not my responsibility. I mean, it's too many times. So I think the first and most important thing for people to understand is that it is your responsibility, that it is on you to actively advocate for the things that will benefit you, your family, and your community. The only way to do some of that is to get involved in policy. Now, what does policy actually mean, though? Let's define that. So my mentor always taught me that policy was movement in a direction for a reason. And so if the policies that keep you where you are aren't moving you or your family in a direction that helps you, it's probably not a great policy. So we need to create new policies that move us in a new direction, help us achieve our goals. So number one is recognize that it's your responsibility. Number two, to recognize how to get involved and actually to know how to ultimately take action on policy. And that begins with simple things, knowing what your issues are. What are you passionate about? I mean, what are the things that keep you up at night? What are the things that prevent your family from being most successful? And once you realize what those are, inevitably there is a policy or someone who's overseeing the policy that you need to be talking to. And then bring them solutions. You got to bring solutions. So once you identify the issue, you got to know what to recommend happens next. So take people's solutions, even if you don't know what the policies are. I bet you got a good idea on what needs to change and what needs to ultimately be the outcome or the solution that you're aiming for. I think if more people got involved in that simple mindset, this world would be a ridiculously much better place.
Great advice, as always. Thank you so much, Dr. Miller. Really exciting to have you here as one of our advisors for the Upswing Fund. And thank you for sharing your expertise today.
Oh, no, thank you, Salome. You're a wonderful leader, and I really appreciate all that you all are doing with Upswing. It is going to make a difference.
Thanks so much.